Well, we're here with Dr. Chiu, a dentist who has two offices, actually, Dr. Chiu. You have one in Highland in California, like in the San Bernardino area, right? And one in Rancho, Cucamonga, which is also San Bernardino, I think, right?
Yes, that's right.
Okay. Well, Dr. Chiu, tell us a little bit. What is in your two practices, in your two dental practices, what is some of your, major philosophies of how you treat patients? Obviously you treat them well and all that type of stuff, but, what are you emphasizing on it? Are you providing a very rounded service, or are you specializing in one thing? Are you pushing very, very heavy the cosmetic, or is that just something you do very well, and you're making sure that people more like kind of stay healthy with their mouth? Because I have heard, and from you, there are a tremendous amount of reasons going on in a person's mouth why, health factors which then affect the rest of the body much more than most people can possibly imagine and have known in the past, much, much more. And so what are you paying attention to? Maybe tell us even why did you become a dentist? I mean, what makes a person become a dentist? Like people become a fireman for a passion, and a policeman for a certain passion. What makes one become a dentist? Why did you become one?
I became a dentist because I wanted to help people. I wanted to take care of their health, and dentistry seemed to follow that field. In my practice, I'm a general dentist. I do practice general cosmetic dentistry. I do implants, orthodontics, but my goal is to just provide healthy teeth and gums and provide cosmetic work at the same time. So my emphasis is to keep people healthy, and keeping a mouth healthy also helps keep the rest of the body healthy. So
yeah, because yes. As you have mentioned in other videos, like if a person has gum disease, he really ruins the kidney, the liver. We have heard that he ruins the heart and can get heart attack, but people didn't take it very serious. Now, on the other hand, we have surgeons. When they do a hip operation, or for that much appendix operation, or some such thing, they send the patients to a dentist to get a clean bill of health in gum disease, because an existing gum disease can make surgery very, very, very dangerous. They just recently found out, and it makes sense, because you wouldn't operate on a person if he has infections in the body, and that's what gum disease are. So tell me, do you do gum disease treatment in your practice, right?
Oh, yes, of course. That's actually,
go ahead.
Yes, we do focus a lot of that. That's very important. That's the foundation. The gum disease needs to be stabilized to keep a good foundation for the teeth health and also for the rest of the body.
Good. What about orthodontic works? The braces, straighten out that. You do that also?
Yes, I do. That's also part of my practice focus, yes.
All right. And they have this new thing called Invisalign there, which apparently is quite comfortable and has some advantages. It's not the answer to all orthodontic work, but it is apparently quite a thing. Are you doing that also?
Yes, I am. I do provide Invisalign or clear aligners options for braces.
Great.
Yes, and there's a lot of benefits of them. Yeah.
Good. And implants. You do implants?
Yes, I do.
Are you doing those dentures? That these days they have these dentures, and those dentures are implant supported. You put a couple implants on it, and because of it, they become like a world of difference in how good they are, apparently. Do you do those?
Yes, I do. Actually, yes, a lot of patients have benefited with this new technology with the dental implants. It's just attaching two implants to a loose denture. It makes a world difference. Patients can eat without them falling off. It makes a big difference.
Yeah, and it doesn't cost the price of a whole round house of mouth of implants, which costs, tens and twenties and thirties of $1,000. So it's kind of like, yes, you didn't exactly buy the Maserati and the top line Mercedes, but boy, do you have a hell of a good car there, an Infiniti, Lexus or something like that, right?
Yes, correct. It's much more economical putting two to four implants versus the whole mouth implants, and it makes a huge difference on patients with loose dentures.
Right. And what about children? You see children in your practice?
Yes, we do. We love seeing children in our offices.
So you really kind of do the whole range. You obviously pull teeth and do all that type of stuff. And you do bleachings, teeth whitening and cosmetic dentistry, veneers and lumineers and that type of stuff. Wonderful. Well, what would you suggest as one just very short, kind of 30-second note? What would you recommend? What is one of the very important things any patient should do when it comes concerned to his overall health and maybe specifically his dental health?
Well, definitely the very basic thing they should do is brush and floss every day, and go to see a dentist every 6 months. Make sure we catch the little problems early and prevent bigger problems later. So. Those are the most important things for patients to know.
Yeah, I've heard that going to the dentist every 6 months really catches especially the gum disease, which in itself is the root of, it's more and more becoming known that it is the root of tremendous amount of evils, not only tooth loss, but also general health. Well, thanks for your candidness. Thanks for letting us know. We'll talk more about other topics. Bye, Dr. Chiu.
Bye. Thank you for having me.